You're listening to Heroes of Healthcare, a series about the bold, selfless, and innovative individuals who are serving our communities with compassion and care. This episode is sponsored by Jackson & Coker Locum Tenens. If you are seeking interim physician or advanced practitioner coverage at your facility, or are a practitioner who is looking for more work-life balance, visit them at jacksonandcoker.com to learn more about their services. Now, let's get into the show.
Welcome to the Heroes of Healthcare podcast. I'm your host, Ted Wayne. Today, I'm joined by three friends, Corey Feist, CEO, Dr. Stefanie Simmons, CMO of the Lorna Breen Heroes Foundation, and Tim Fischer, president of Jackson & Coker, this show's sponsor. They are here today to discuss an exciting exclusive partnership that they've entered into this past week to address the well-being of our physicians and advanced practice professionals nationwide. As our listeners know, physician well-being has been a continuous topic for us on the show and a passion of both our production team, myself, and our sponsor, Jackson & Coker. I was introduced to the foundation by a cohort of well-being-minded professionals we've had on the show. People like Dr. Desai, Dr. Jacobs, Dr. Ahn, Heather Isola, and many, many more have advocated for the crisis that the country is dealing with as our healthcare professionals are dealing with undue pressure, unknown psychological stress, and many other issues that are impacting already a shortage of professionals that we have in the market. The Dr. Lorna Breen Foundation's mission is to reduce burnout of healthcare professionals and safeguard their well-being and job satisfaction. Born out of the tragic death of Dr. Lorna Breen herself, whose story we'll hear more about today from her brother-in-law, Corey Feist. Our sponsor, Jackson & Coker, is a healthcare services company that identifies professionals, temporary physicians, and advanced practitioners who can work across the 50 states. J&C is getting healthcare professionals where they're needed now, and they share in the foundation's passion for making sure that the work environments that our healthcare professionals in are allowing them to be the best that they can be to provide the right service and care to the patients. These two leaders in physician well-being organizations are partnering to help accelerate the word about the crisis we are facing and to bring solutions to the market that make sure our healthcare professionals are where they need to be and practicing at their best. So without any more background, let's hear more about this powerful partnership by welcoming our three guests to the show. Welcome to the Heroes of Healthcare podcast, Tim Fischer, Dr. Simmons, and Corey Feist. Thanks for joining me.
Thanks for having us, Ted.
It's a pleasure, Ted.
Well, this is fun. Obviously, we know each other for a while now, but it's great for us to get together and start to talk about this exciting venture that we're heading into. Such a needed thing in the marketplace, and really excited to see how the two organizations are joining forces to bring this and help accelerate the great work that's already being done. You know, Corey, why don't you kick us off and tell, for those who may not know, the powerful story of Dr. Lorna Breen and what triggered the Foundation Heroes program to kick off.
Sure. And, you know, it's really an honor to be with you today. And I'm not just saying that because we have a lot of people in charge of your salary who are listening to this. It has really been a wonderful journey that we've been on with Jackson & Coker, and the leadership team, the entire staff has just been unbelievable. So thank you for having us today, and thank you for joining us on this journey to help improve the well-being of health workers. So our foundation began in the spring and summer of 2020 following the death of Dr. Lorna Breen, my sister-in-law, who was an emergency medicine physician and medical director. So she was in a leadership position at a very busy emergency department in New York City at really ground zero of the COVID-19 pandemic. Lorna was getting her MBA at Cornell Business School, trying to advance her career, had been double boarded in emergency medicine and internal medicine, and had really been a growing physician leader, really trying to refine her skills and take care of the workforce as well as she could take care of the patients. And Lorna experienced her first and only mental health episode following her premature return from COVID, contracting COVID herself, to the workplace. She was so moved to run back into the burning buildings, if you will, and help her colleagues with the growing volumes of patients who were dying in the waiting rooms and running out of portable oxygen and really trying to help, that Lorna really put aside her physical COVID real difficulties and ran back into that fire, and only to immediately find herself in a position where she had to sacrifice her own well-being to continue the fight. And April 1st, 2020 was her first day back to work after that COVID-19 diagnosis virus that she still had in her body. And she called our family that morning and said, once she had been back to the workplace, that she had never seen so much death and dying in her seasoned career. And she was concerned she couldn't keep up. And so instead of heeding our warning and really our advice to go home because she was still very sick, she said, no, I've got to stay in this fight, and I've got to demonstrate that I'm tough and I can take this, because if I show weakness now, it may be perceived by my colleagues that I am not good enough and I am not worthy enough of this medical director title. So I need to keep pushing on. Lorna really tried her very best, working 15, 20-hour days, back-to-back shifts, and ultimately found herself catatonic in her apartment in New York City in a very, very compromised position. So much so that we had to medically evacuate her with her best friend from medical school, driving into New York from Connecticut on a moment's notice to start driving her south to Virginia, where we were able to get her first and only mental health treatment. Prior to that time, Ted, I had been in healthcare my entire career, first as an attorney, then as a healthcare leader. And I was at that time the CEO of the UVA Physicians Group, which employed all the physicians and advanced practice professionals who provided care in the UVA health system based in Central Virginia. So I had been very aware of the increasing operational challenges that the workforce had been experiencing that was really causing their burnout in the first place. And we had done a lot of work to mitigate that. However, what was abundantly clear to me was that I was completely blind to these mental health stigma, this concern around showing weakness, and then ultimately the concerns around the ramifications professionally for obtaining mental health treatment. So the tragedy upon tragedy of Lorna's story is that once we obtained the needed mental health treatment and got her first and only treatment of her life, she then said, now that I've obtained treatment, my career's over. My license will be compromised and I will never be able to practice medicine again and do what I've only ever wanted to do since I was a child. And my wife and I are both attorneys by background. My wife, Jennifer, is her little sister, and was really trying to actively dissuade her from that concept and just really dismissed it, not understanding the significance of the statement. And for me, I'm thinking, it's 2020. There's a thing called the Americans with Disabilities Act. There's no way these doctors and nurses and other licensed professionals ask these questions. This is just, there's no way. Well, only come to find that she decided to take her own life because of it. And the response by the workforce to us as a family was really so overwhelming that we could not ignore what they were saying to us, which was her concerns are real. And the working conditions in healthcare place too much focus on patients and not enough focus on the caregivers themselves. And really something had to give. So it was really the response by the workforce to Lorna's passing, which opened our eyes to the needs to then ultimately create the foundation, which is the journey we've been on really since spring of 2020.
Well, that, and so much, just kind of stop you there for a second. So much what I appreciate about your story is here you are living through this tragic moment and really wanting probably privacy, right? This is not an opportunity or a time that we want to be dealing with press and media and stuff. But yet, due to that outpouring, what I really appreciate the courage you guys showed was, hey, let's see, this might be an opportunity to make lemonade out of lemons, right? This is a terrible situation, but you know what? Maybe this is an opportunity at the same time.
Ted, I appreciate you saying that. I wish I could say it was because we were brave. There's a fine line between brave and stupid, right? I'm constantly stepping over it. I was sitting in this exact chair begging the editor of the New York Times through tears not to publish her cause of death 11 hours after she died because we desperately just wanted to be sad. We were shocked. And there's a lot of stigma around suicide. So we weren't sure what we were supposed to say or what we could say or what we should say. And we just wanted to grieve. And when the publicity came out over our objection, we had a flood of media requests. And, it's hard to describe that scene of the family members literally kind of piled on top of each other, just mourning and crying and being sad. And to have, knocks on the door and, doorbells ring and your phone's blown up and somebody wants you to go on and tell this story that just happened and you're still not sure what happened. And it was unbelievably painful. The other thing, though, that happened was that because her story was starting to get sensationalized, we felt very much called not to sensationalize a story around a suicide, but to tell the story of this incredible woman who was just giving her all, like so many healthcare professionals. I mean, Lorna was as unique in some ways as her name, but she was as common as any other health professional I've ever met who just would put everything that they have before themselves. And that was the thing that was so important for us to talk about, which is why we agreed to share her story once it was kind of out there. It was a defensive strategy, if you will, because we just wanted people to not sensationalize a suicide, but talk about the humans of healthcare.
Yeah, as I've mentioned before, we talk so much on the show, and obviously that was the linkage here about physician, burnout or well-being and the pressures that they're under. And, we covered so much of that in COVID through the middle of COVID that you're right. I mean, she is a special individual for sure, but there are a lot of healthcare workers who living in the front lines like Lorna was.
And so many, as Steph and I go across the country and we talk to healthcare professionals and leaders who are also just as burnt out now as the workforce themselves, by the way. But when we go back and we say, how much of the trauma that you experienced during COVID now, how much of that have you processed? How much treatment have you gotten for yourself? How many conversations have you had with your colleagues? How much processing have you done? The answer is usually somewhere between 0 and just a very little bit. And so we have this mounting burnout for the country right now. And we still have a very, very injured workforce. So much so that recently in October, the Center for Disease Control, just down the street from Jackson and Coker's headquarters, published their Vital Signs campaign calling the mental health of health workers as a crisis and comparing health workers to every other workforce, saying they have it worse. And part of that is because when they looked at what their mental health state in 2018 compared to 2022, COVID-19 had dropped a bomb right on the workforce. So
yeah, 100%. Well, so last question, and then I go over to Dr. Simmons, to Steph. She's allowed us to refer to her as Steph. When in the process of, grieving, which is not an event, it's a process. During the process of grieving, getting this media attention, what was the genesis of saying, hey, let's form the foundation. Let's form a thing that is going to make the difference. Instead of just sensationalizing or telling the story of Lorna and trying to bring empathy around that, how do we make it into a movement?
Well, yes, it's from a moment to a movement, right? So the movement had predated the pandemic, let's be clear. In fact, many healthcare organizations, including the National Academy of Medicine and others in 2019, were saying that the real issues of 2020 were going to be workforce issues. So there were a lot of people working on this. It was an interesting moment, and I can't tell you that there was a exact moment when we made that decision, but what we thought was based on our professional backgrounds and then the flood of people who are coming at us, and just looking at the landscape within healthcare to say there are so many organizations who are going to have to add this as another thing, that we said, hold on a minute. We need a singular organization whose mission it is exclusively to focus on the well-being of all health professionals.
Steph, you got to hear about this and followed it, and in your background in working in emergency room, and that, obviously this was touched a nerve for you and became a passion outlet for you as well.
Yeah, thanks, Ted. So, I'm an emergency medicine physician by training and had practiced in emergency medicine my entire career. But I've also had a real interest in the way our teams work together and the way that people interact with each other in medicine, the relational aspects of medicine, whether that's patients and clinicians or physicians and their teams or physicians and teams and their leaders in a hospital. So my career has really been a combination of teaching, research, and administrative leadership, patient and clinician experience, first at the hospital and health system level, then for a large national medical group serving over 26,000 healthcare workers. And so I had over a decade of experience leading the strategy and program management of professional well-being programs in hospitals and health systems around the country of various sizes, urban, rural, different types of specialties and healthcare workers. And in fact, it was one of the physician coaches that I trained in that program was getting his MBA at Darden School of Business, where he sat in on a very interesting talk by one Mr. Corey Feist on the Dr. Lorna Breen Heroes Foundation genesis. And he said, Steph, you've got to talk to this guy. You are talking about the same things and in the same way. And gosh, Corey, I think I cold called you on LinkedIn for a phone call. And I remember taking a walk down my street with my headphones on and talking to you for about an hour and a half that first time. And just hearing what you were doing, sharing what we were doing, and the type of difference we were trying to make. And Corey and I worked together on a couple of projects over the next year. I joined the foundation as a board member and worked in that capacity with the foundation for about a year. And last year, at about this time, was seconded by my employer at the time to the foundation as chief medical officer. And in January of this year, started as chief medical officer full time. So that's been my journey coming to the foundation. And, I'll tell you, the reason I do this work started as early as the reason I decided to be a physician in the first place, right? Which is to try to help or stop, just to try to help, to use your talents to make the difference in the world. And that started first with patients and then with systems, and then realizing that the systems are damaging people and you need healthy people to work in a healthcare system. Healthcare workers need to be healed before they can heal, and they need to be healthy before they can heal others. And so I sort of worked my way through that internal process of realization and my own personal journey of doing that for myself, and then found this work and along the way, this foundation. And I'm thrilled to be here.
It's great. Yeah, it's like what's the analogy on the airplane, right? Put your mask on first before you put the oxygen mask on somebody next to you, right? Because if you can't do that, you can't, provide value to the rest of the people. So,
Ted, I'm a mom of 3. Okay, can you imagine your cabin has lost pressure and your 9-year-old is sitting next to you?
Mm-hmm.
Every cell in your body is going to be screaming out for you to put the mask on the child. And yet you'll pass out before you get the chance. And so that's where our healthcare workers are. Every bit of their being is already predispositioned to help others and then trained to within an inch of their life, literally, put other people's needs before theirs.
100%. Sure.
And that's where they are in this work. It's very difficult.
Yeah. As you said, Corey, it started as an employment crisis, but this part of the crisis is just exacerbating the shortage, right? So we don't have enough people, and the people who are in it are leaving. So we need this more than ever. So obviously, when I heard a lot of the Lorna Breen story and the foundation's work, I heard a lot of similarities between the work that Jackson and Coker was trying to do, and got together with Tim, and we took a look at it, and we said, this seems like a no-brainer. Tim, you want to talk a little bit about, when we kind of first started talking about this is an organization I think we should be associated with?
Well, I think we talk a lot here about what breaks your heart, and then when you find things that break your heart, you want to be involved, and you want to what Steph and Corey said, you want to be part of helping make a positive difference. So sometimes you can't run a business case. Sometimes it's not an MBA exercise on, financially, is this the right thing to do? Sometimes you just say, you know what, this breaks my heart and I want to be involved. And I think it was almost as simple as that, as you know. And then we figured everything out later. But our mission here, and we're very mission focused at Jackson and Coker, is to connect providers and communities to transform lives. And I'm guilty of focusing more on the patient side because I grew up in a small town in rural Illinois where there was a hospital and nobody went to med school wanting to work at that hospital. So I grew up with a lens of physicians. You may have a lot of physicians in New York or Boston, but you don't have them in my small town in Illinois. So the locums industry to me is a passion. It is a passion because I lost people I loved because they didn't get the same quality of care that you would in a metropolitan area. So, you come from that angle of we're a mission focused company that's focused on physicians and advanced practitioners. And then you hear something like Dr. Lorna Breen's situation, and you're like, you know what? We need to be involved in that. So I don't want to simplify it too much, but it was really kind of that simple.
Yeah, and I think it was a little bit of an aha moment when, we were on a call with an advisory board member and they said, what are you doing to make sure the locum doctors that we're employing have the right work environment that they want to be? And you and I looked at each other and were a little embarrassed and said, not enough, which was go ahead, please.
I felt very convicted when Corey asked me that because I think it's easy to get focused on the business side and focus more transactional than it is that, yes, we have to serve patients. But to Steph's point, the best way for us as a locum tenens firm to serve patients in those rural areas is to have physicians who are healthy. And I think locum tenens is a great way for physicians to do that. And more physicians are working in locum tenens because we say, if you're burned out or your well-being isn't good, specific to your workplace, and you're doing locum tenens, you're doing it wrong. That's the whole point. There's a lot of flexibility, and you can pick the assignments, you can pick where you want to go, you can pick the environments that have good leadership and good culture, and the administrative burden is not as high as it is in other places. So, leadership matters, and it's not just in the business world, it's on the healthcare side as well. So if you can work in a facility that values you and you're appreciated, I think that helps with all the issues that we're talking about.
Yeah. And for those listeners who might be new to this industry and world, we use the word locum tenens, which is Latin for in place of or instead of, which is temporary doctors. And it's become a very big part of the healthcare workforce and manpower planning system. But I just wanted to make sure we're not throwing around all this big lingo that nobody understands what we're saying.
I just wanted to pick up or continue to pull a thread that Tim just started with, which is the feeling of too much business and too transactional, because that's what we hear over and over again from the workforce. They feel like they've become cogs in the wheel. They feel like it is all about bottom line numbers, 15-minute sessions with your patient, regardless of how complicated the care is, and. And so I think it takes a special leader and group of leaders to recognize and kind of pull your head up for a minute and say, this is not a business in that traditional sense. You have to think about the impact of this work on the workforce. And I just want to commend Tim, Ted, and the entire leadership team for having that vision, which is our vision, which is how do we create a workforce environment where the workforce can thrive and then do their best possible job taking care of patients and take a little of that transactional nature out of it. So thank you for using those words. And I just wanted to put an underline and exclamation point after it.
It's interesting when you think of the traditional triple aim in healthcare of patient experience and population outcomes and cost of care. That was transformed into the quadruple outcome, right? Which includes the impact of the work on the healthcare workforce in recognition of the fact that if you only optimize for the first three, you can't actually optimize for any of them because you need to be thinking about the impact of the work on the workforce in order to accomplish any of the other three. As Corey said, this isn't creating widgets on an assembly line. It's people work, and people work. It's really important to make sure that everyone is aligned and pulling together to do the work with each other, and that you have time and space for empathy and for deep conversations and for understanding people's goals of care. If you are optimizing work output per time, all of that is going to fall away. And so organizations have been finding for years that their patient experience is declining and that they can't retain healthcare workers. And we've seen accelerating rates of burnout. And a lot of that is because of the lack of attention to the impact of the work on the worker and how that really plays into the other three aims.
No, 100%. There's obviously so much being done and studies around all of this. The new workplace demands that balance, right? That balance. And, people say, oh, it's Generation X or it's Generation Y or, and I'm a boomer. And work-life balance is critical. And when you start to see what it can make your life and how it can make it more enriched and meaningful, it becomes a necessary ante to play. So the old model of, just grind it out just doesn't work anymore. So Steph, let's talk about what is some of the tools that the Lorna Breen Foundation has put together to help be a solution to this problem.
Thanks for that question, Ted. And, we like to talk about our three main aims. And one is awareness, helping to spread awareness about this issue and what needs to be done. The second is advocacy, and that includes at the state, but also at the federal level. And we're in the middle right now of getting the Dr. Lorna Breen Healthcare Provider Protection Act, which provides funding for professional well-being programs around the country reauthorized. That's an example of advocacy. And then last but not least, advancing solutions. So helping organizations advance and accelerate their work in improving the professional well-being of their workforce. So one of our signature programs in advancing solutions is the Caring for Caregivers program. And we have started that on the state or Commonwealth level, first in Virginia and now in North Carolina. What Caring for Caregivers is, it's a series of 3 steps. And the first step is a public commitment by organizations and by the state or Commonwealth to eliminate the barriers that healthcare workers face in receiving mental health care. 2 of those barriers take the form of questions that are invasive or stigmatizing about mental health care on licensing forms at the state licensing level and on hospital credentialing forms. So, for instance, in Virginia, in step 1 of Caring for Virginia's Caregivers, the Commonwealth of Virginia changed a law saying you can't ask these questions in the licensing application of any licensed healthcare worker. That impacted over 500,000 licensed healthcare workers in over 60 professions. But they took it one step further and they issued a challenge to all of their hospitals to change the credentialing questions in the hospital. And 75% of the hospitals in Virginia were able to change their credentialing questions. And the impact of that work was just published in the American Journal of Public Health last week in a supplement specifically around healthcare worker well-being.
Well, and congratulations on that, because any of the listeners who are from the healthcare world know that changing credentialing is not an easy step.
So you'd think that. But we had organizations do it in under 48 hours in their organization. So there's needs to be a will to change.
But you told us that in the past because, in the Locum Tenens world, obviously we're getting all of our physicians credentialed at each of the locations so that they have privilege to work. And, when we would have a little technicality or something, they would tell you that to change that in credentialing is an act of Congress. It's not going to happen. Forget it. It has to go to the board and everything. But then when you told us the story, I said, when there's the right motivation and the right people, you can impact it.
Well, we saw an act go through Congress in under 18 months. So that's step one of caring for caregivers is licensing and credentialing reform. And the second step is for healthcare leaders to come together and engage in education around the drivers of burnout, really effective approaches to changing the professional well-being environment, and how to put together a professional well-being team. So actually earlier today, we launched the step 2 of caring for caregivers in Virginia. And then step 3 is even more exciting. So in step 3, leaders in a hospital, health system, in a state come together in a learning community, and they work on projects and programs together that change the environment for the healthcare worker. And typically that's going to be around quadruple aim quality, adding human performance indicators into existing quality projects, or in reducing administrative burden for the healthcare workers who are interacting with that organization or in that state. So you asked what we're going to be doing together. And in a phrase, I would say caring for Jackson and Coker's healthcare workers.
Tim, you want to expand on that a little bit?
Well, I think there's an opportunity from our standpoint at Jackson and Coker to partner with the Dr. Breen Foundation really in 3 ways. I mean, first of all, and I'll give a real life example. I mean, we have a lot of recruiters who are talking to physicians every day, probably 1,000 plus physicians every day. We're talking to them. And Corey came and spoke at our kickoff meeting last month. And I would say prior to that meeting, a lot of times, back to the transactional point, a lot of times our recruiters were calling the physicians and saying, hey, we have an opportunity in Biloxi, Mississippi, or anywhere in any of the 50 states, and we can pay you this. Are you interested? So it was very transactional, where now, because what Corey said resonated with them, now, instead of starting with the transaction, they're starting with, hey, how are you doing? Like, why are you wanting to do locums in the first place? So they're asking questions to understand why this physician or advanced practitioner wants to do locums in the first place. Because a lot of these people are employed. It's not like they're looking for a job. The stigma from 20 years ago in locums is they couldn't find a real full-time job. That's not the case in today's world. Many of these physicians are top-notch. Some of them are department chairs, and they're doing locums for different reasons. So just as something as simple as that, and that goes back to what Steph just said around awareness. Our recruiters talk to physicians every day, but they weren't truly aware of the challenge that physicians and advanced practitioners have every single day. So I think something as subtle as that, where from a Jackson and Coker standpoint, we're trying to understand why the physician is wanting to do that. Are you hurting? And how can we help? And I've had stories that have been shared with me since Corey talked a few weeks ago, where we have put physicians in touch with someone who can help them. And it has nothing to do with us putting people to work. They were hurting. So I think something as simple as that, just caring about the well-being of the people that we're talking about every day, as opposed to focusing on a transaction. It sounds so simple, but we weren't doing it.
Right. Yeah, I know. I think, Corey, you told us the story once about the board member of yours who does a lot of locums work and who said, I've been doing it for years and I never once had a locum organization ask me, how was I doing?
Yeah, I mean, and Tim, I got tears in my eyes hearing that story. In some ways, this is so simple, isn't it? And I'm looking at the screen and it says Heroes of Healthcare podcast. Maybe we should retitle it Humans of Healthcare podcast. It is treating each other the way that you want to be treated. And I know everybody gets into the mode of grind and the next thing and the next thing and the next thing. But if we've learned anything from the past few years, it's that we really have to take care of each other. And the sad state of affairs in some ways is that all it takes is someone to ask how you're doing to then differentiate the organization from the next guy, right? Because no one else is doing it. But what you then are going to do is then you're going to have others trying to chase that. And what that will do is you will have what Jennifer likes to call the butterfly effect, right? The wings of one butterfly is creating huge change downstream, and we've already felt it. So I just had to interject and say, you're exactly on the right track. Now, there's a lot more complex things that we need to do, but we have to build that foundation together of just caring about folks at a human level and walking that talk every day, not just simply trying to check a box because I called my goal is to call a certain number of docs every day. And I called those docs. Well, did you ask them how they were doing too? And if they needed help, did you help just facilitate it? So thanks, Tim.
No, completely agree. And I think we have to be careful too, not to check the box on, did you ask them how you were doing? Because there's a way to do that that's genuine and sincere, as opposed to, oh, I was told to ask this. And people can pick up on that. So it has to be from a true position of, I care. We'll talk about the potential assignment here in a minute. But first of all, explain to me how you're doing. And when you do that, and again, I've heard many stories in 3 weeks where people are having meaningful conversations that they never had before.
I got to say, I worked for multiple decades with over 1,000 physicians. And it really wasn't until we started talking about this openly that so many of them have taken me aside to just really have a real conversation about how things are really going or what what challenges they've really had. I mean, they feel so isolated, and they feel like, particularly when things aren't going well, there's so much armor that you have to wear, especially in healthcare, that you can't show any weakness at all, because to be vulnerable, to have honest and open conversations, particularly when things aren't going well, that is just antithetical to what we do here in healthcare. Well, I call BS on it. And I think what we're demonstrating is, again, I'm just retitling your podcast, Humans of Healthcare podcast, because that's what we're treating them as, humans, before we give them this accolade hero, for sure.
I like to think about it as a backpack, because when you're caring for patients, it cannot be about you. It just can't. That's not the job. And so when you're working in the emergency department, when you're working in the ICU, in the clinic, on the floor, you're hearing and seeing and witnessing a lot of human suffering. That's the job. That's an unavoidable stressor of the job. There are avoidable stressors, some of the administrative burden, some of the ways the systems are put into place, but that's an unavoidable stressor. So what do? You throw it in your backpack, and then you go on to see the next person, and the same thing happens. And what do? You throw it in your backpack, right? And so you're carrying around this burden. And if you don't take time to take your backpack off and unpack it, right, you're either going to fall over on your back like a turtle and be incapacitated, or you're going to be so burdened by your backpack that you're not able to efficiently climb the mountain ahead of you. So that's what we need to encourage healthcare workers to do. Just take a moment, take your backpack off, unpack it, unpack that backpack with a professional, see a therapist, talk to somebody. And then when you put it back on, you're still shouldering that burden, but it is so much lighter, and you can go out and do that hard job that you're trained to do and do well.
Or somebody's sharing the load with you.
Yeah. And Ted, to that point, one thing that I don't think I fully had thought through when we started talking about this, but I've learned in the last few weeks, is we're in a unique position at Jackson & Coker because we don't employ any of these physicians. They're independent contractors. They don't work for us. So they're more willing to talk to us than they are where they work full time. To Corey's point that he shared when we started this conversation. So they probably are telling us, I don't know this for sure, but they're probably telling us things that they would not tell their employer. And the ability for us to point them towards Dr. Breen's foundation or towards somewhere else, depending on where they are, that's powerful. So we can work. You ask about the partnership. I think that's an added benefit to the partnership that I probably didn't think through, but I've seen in the last few weeks because they share things with us that they're not sharing elsewhere.
Yeah, I'm sure as the relationship continues over the next several years, there'll be a lot of learnings through this process, which will be good either way. But I also love the work that we're doing. We just talked about on an individual basis and being human to the individual. But I also love the momentum you guys are getting, and you touched on it in the state level, which is, I don't want to be a physician who's now filling out a credentialing application and I'm abandoning the application of a place I want to work because I'm not comfortable answering the questions because maybe they're illegal or maybe they're invasive or whichever. But I'm worried that I might have to disclose something that I'm not comfortable disclosing and doesn't need to be disclosed. So that changing of at the state level or at the facility level, wherever you can, to say those questions are not relevant to the person's ability to perform and you've got to remove them. What's the state number up to? I know you guys, like I said, you guys do everything faster than everybody else expects, but where are you guys now with that?
I can take that one, Steph. So every type of health professional has their own licensing board. So the first place I'm going to talk about is physician licensing, but then I'll get to nursing licensing. For physician licensing, when we began this work and we launched a challenge to the licensing boards that license physicians, in November of 2022, we had 19 states that obtained our national recognition through our Champions Challenge badge. In less than a year, we were at 26 states. Importantly, with another 12 on top of those working actively towards badge recognition. So there are currently in this country roughly 700,000 physicians who work in states that have our badge recognition, where it is okay to obtain mental health treatment without fear of negative consequences on your license. Steph identified before that one of the ways that we've done that is by changing laws, even though they're not required in most cases to get these boards of licensing to change their questions. We went to the legislature in Virginia and said, don't just change medical licensing, change licensing for all 62 health professions. Let's benefit 500,000 health workers in one state at a time. Boom. The nursing licensing is sadly behind. We're working very quickly on that. We did not officially launch our nursing challenge till this past fall because we were really trying to get some real focused progress on the medical licensing. And I think the numbers are somewhere around 15 states for for nursing licensing. But we've got this huge campaign moving. The other thing that we've done is we've moved huge swaths of hospitals together. You know, again, just commenting back what Steph was saying before, in Virginia, as an example, we went in less than a year from having 0% compliance with our recommendations for the hospital credentialing questions to then 75% of the hospitals in 1 year, notably with the largest hospital system in the country, HCA, changing their questions, not just for the Virginia hospitals, but for all 300 plus facilities that they have across the country, benefiting, tens of thousands of physicians. So there's a lot of work to be done. But as you were saying before, this is one of those issues that I always identify for leaders as in that 2x2 change matrix. When you're looking at impact on one quadrant and effort on another, this hits the quadrant everybody tries to hit, which is low effort, high impact. And when you then point it out that this is doable, we give you a free toolkit to do it and a badge for doing it. It's really amazing when you get the leaders to go, wait a minute, we didn't even know we were asking these questions. We're horrified we were asking these questions. Let's change them right away. So it's been quick progress.
I think it's worth pointing out too, like changing these questions, eliminating invasive and stigmatizing questions about mental health care that we don't ask about physical health care is the right thing to do. It removes a barrier for healthcare workers to receive mental health care. And last year, 3 senators, Wyden, Merkel, and Booker, wrote to the Department of Justice asking them to enforce the Americans with Disabilities Act around these state licensing questions. And the Department of Justice wrote back and said, you're right. To the extent that these questions are used in hiring, they do violate the ADA. And if you know anyone who's been harmed by that, please direct them to action. And so it's also the right thing for organizations, irrespective of the impact on the healthcare workers, to be compliant with the law and to do the right thing here.
So as we're coming up on time, what's next? What are we doing? We just made this big announcement. It's clear what we're doing. So it's clear where the value is and who we're trying to help and impact. What are some of the things that we should look forward to? Two things. What are some of the things we should look forward to in the next coming year or 12 months? And then if listeners want to get involved, how do we want them to reach out?
I'd love to answer that question 2 ways. And one way is, what should we look forward to with Jackson and Coker, right? And then what should we look forward to nationally? And what's up on the horizon in professional well-being? And I'll take the first, Corey, if you want to take the second. So I'm really looking forward to working with Jackson and Coker and going through the program of thinking about how we can address licensing and credentialing and advocate for these licensing and credentialing reforms, providing access to Jackson and Coker's leaders and employees, right, about the drivers of burnout, what can be done to address burnout in healthcare workers, and then working with the teams, Tim, that you lead and that do the work at Jackson Coker to think about how they can positively impact the healthcare workers that they work with, right? The physicians and the APPs that they interact with, whether that's by reducing administrative burden, by reaching out, connecting people to help, and really make a substantive difference for the folks you interact with in your work. I'm excited to see where that takes us.
Yeah, we would love to engage with your audience. So first of all, and I think most importantly, if you're interested in working with us and you're not already in the Jackson and Coker family who is already engaged with us, go to drlornabreen.org. And to your specific question, what can they do? If you go to the Take Action section, if you're an individual, you can use our website and contact Congress, ask them to reauthorize the Lorna Breen Act. Contact your state licensing board if you're a doctor or you're a nurse. Ask them to change their questions. Become an ambassador of our organization. If you're a student, form a student chapter. If you're an organization, you can help implement our Caring for Caregivers program, or you can remove barriers to mental health access by using our toolkit. You can also learn about how to prevent suicide of all of your health workers. And so there's a lot to be done by just going to our website and engaging with it in a way that helps you on the journey that you're interested in making. And at the end of the day, we would love to talk with you and try to partner with you because our organization is small but mighty. We've been very intentional that we are trying not to duplicate infrastructure that is already out there. So if you're an organization that already has some of these tools and you want to partner with us, great. If you want to help us reach other audiences, fantastic. More importantly is to start the conversation with us. So, this has been an amazing conversation, I would say, today. And we're so thrilled at this partnership with Jackson and Coker.
Well, yeah, first, I just want to say we're honored to partner with Foundation and Corey and Steph. And the work that you have done in a short amount of time is simply amazing. So we're honored to be a part of it. To answer your question, what changes for us? I think we're going to change the way we do business. I know that sounds kind of silly, but we have to do a better job when we're talking to and advanced practitioners. As I mentioned before, we have to do a better job when we're talking to our clients, who are healthcare organizations in all 50 states around the country, to ask them questions about what are they doing around the issue of burnout and well-being. So how we interface and communicate with customers on both sides, the physicians and APPs, as well as the clients. And then internally, we credential people as we're credentialing them for the facilities, and we're looking at our own questions that we're asking. And then we can partner with the MSOs at our clients and make them aware, because one of the three tenets that Steph talked about was awareness. And a lot of times people simply are not aware. So I think as a locum tenens firm, we're in a unique position to touch all three aspects: the physicians and APPs, and obviously the foundation focuses on all healthcare workers. We focus on physicians and APPs. So that's where our target is. The MSOs, the credentialing process, both internally and externally, and then also pointing our clients to the foundation when they need help, because I'm convinced a lot of these healthcare organizations want to do something, but they're not sure how to do it. So having a partnership with the foundation and being able to say, hey, we can't do it, but we know someone who can, that's powerful.
It's really great. I had an old boss who once said, if you're kind of kicking around an idea and it works on multiple levels, it's usually a good idea. And that's clearly what I hear here in this partnership. It's not just a one, I'm going to refer somebody to them, or it's that. This is working on multiple levels, covering the three areas that Steph talked about. And then Tim, obviously the constituents that Jackson and Coker touch, and the fact that this has impact on all three areas of the business. As you said, it will change how we do business, which obviously is is a good thing and for the better. So I think obviously we're, needless to say, very excited about this. I want to thank you guys for your time and joining us and giving a little more clarity to our listeners about this. We appreciate really everything that you guys are doing. I usually close out the show with who's your hero, but I'm going to take my liberty and say you three guys are heroes. And I know you don't like to be called that and say, no, I'm not, and humble. And everybody says that. But, you guys are doing things that are making a difference. And in my view, that means something. And we will continue to push it. And the work's not done, but we should be proud of the work that you guys have set off with doing. And I have a feeling it's going to be wildly successful. So thanks for doing it. And thanks for joining.
Thank you.
Thanks, Ted.
Thank you, Ted. Thank you, Tim.
You've been listening to Heroes of Healthcare. If you enjoyed today's episode, please tell a friend or leave us a review wherever you get your podcasts. You can also visit us at www.heroesofhealthcarepodcast.com for more information or to listen to past episodes. Thanks again to our sponsor, Jackson & Coker Locum Tenens, providing interim physicians and advanced practice staff for over 40 years.